Hi, welcome again to the series of cardiology presentations that I'm doing for you guys. This is Dr. Jaitly. In this section, I'm going to be talking to you about what is angina and what are the symptoms and when does it occur, etc., etc. Well, let's look at the heart first. The heart, to refresh our memory from the outside of the heart, this is what it looks like, where we have coronaries or the blood supply running outside of the heart. This is the right coronary, which is the blood supply system to the heart, and this is the left coronary. Remember, heart is a circulating pump. Just to refresh in our memory, it has four chambers, the left ventricle being the booster chamber, which is sending blood freshly oxygenated up the aorta to the rest of the body to supply oxygen, including the heart. But heart is a smart organ also. As we know, it saves a little portion of blood supply for itself. Remember, it has to take care of itself before it takes care of the body. Just like we got to take care of ourselves before we take care of the world, right? Similarly, the heart is a very smart organ. As the aorta emerges out of the heart, this is the aorta, which is a big hose or big artery that's emerging out of the heart. The first couple of branches that come off the aorta are the right coronary and the left coronary, which is the heart blood supply system. So what is angina? Having understood the supply, having understood the left ventricle, let's try and understand what is an angina. Angina is a constellation of symptoms. Symptoms, what are symptoms? Symptoms is like a headache or palpitations or anything that you feel uncomfortable with where you want to go and consult the doctor is a symptom. So angina is a constellation of symptoms, including chest pain, a pain radiating sometimes to the arms or to the jaw or to the neck, and sometimes even to the back behind the shoulders. And it occurs normally as a result of an oxygen imbalance. Either it's because of the lack of blood supply that's occurring within these coronaries, where there is some level of obstruction that's happening here along the coronary tract, or it's because of the increased demand by the heart per se or by the body. So whenever there's an increased demand of oxygen, either experienced by the body or by the heart, or if it's a decrease in supply of blood flow through these coronaries, or it's a combination of the above. So you can have a combination of any of the above, or you could have one of the above. So angina normally occurs because of an imbalance between a supply and a demand of oxygen. Remember, the oxygen is being supplied. If it is lessened, we have a problem. If the demand is high, we have a problem. Or it's a combination of supply and demand ratio going in an adverse balance. It is accompanied by dizziness, palpitations, even nausea or profuse sweating, and sometimes breathing difficulty. Usually occurs on exertion, seldom occurs at rest. If it occurs at rest, that's a very, very serious issue. Then you should go to the doctor within the few minutes. But usually occurs on exertion, like going upstairs or walking up an incline, a ramp, or a hill. That's what the person will define or tell you as. It lasts about 15 to 20 minutes, gets better at rest. Obviously, you're exerting, so it gets better at rest. Or using a nitroglycerin if the person was prescribed by the physician to take a nitroglycerin should these symptoms occur. So putting it under the tongue, not swallowing it, remember, putting it under the tongue should resolve within a minute or two all these symptoms. But still consult the doctor. My advice is consult the doctor and let the doctor be aware that you did have an episode of angina, what you should do, or consult a hospital or call the nearest emergency phone line to get you to the hospital, etc. Okay? Hope these symptoms are considered as alarming symptoms that you are now more aware of, but just be wary of the fact that these symptoms occur past the age of 40, 45 usually, but they should be taken seriously, or any chest pain should in any case be taken seriously, but angina, obviously, with all these symptoms that I just defined, should be taken extremely, extremely seriously. Thank you for your attention. Talk to you soon in my next presentation.